This is the Situation Room, the only way to start your day.
KTN continues to be with us this morning. And as we continue, let's let you know who our guest is. We're going to be looking at oral hygiene. It's a Healthy Friday conversation. Our guest is a dentist and dental care and advocacy champion. Did you know that there were champions for such? Well, there is. His name is Dr. Nyachio James, and he joins us this morning. Dr. good morning.
Good morning to you.
How are you doing?
I'm doing well.
Karibu sana.
Sante.
You're in the hot seat of the Situation Room this morning. And our Friday conversation is around something that sometimes we think, you know what, I brushed my teeth. That's about the end size of it, isn't it? And then we keep it moving. Well, apparently it's not. But we'll get into that in just a little bit. We usually go around the African continent every week. And every week we stop in a different country. We, get the sights and the sounds and the smells and the bites of each country. And then we take their proverbs back. This week, we have been in the Republic of Benin. Benin borders Nigeria and Togo, as well as Burkina Faso and Niger in the north. And one of the proverbs that they share that we'd love to get your interpretation of is this. The green snake said, watching a person is better than biting. The green snake said, watching a person is better than biting. What would you think about that?
Thank you again. So I like the proverb. Mm-hmm. It gives good context. My thought in it is that the green snake probably is cautious, he or she. It fears that if it does attack the man, maybe the man is going to respond. So the green snake is a brave coward. He's not making advances, and if he watches, he gets to live longer. So yeah, that's my interpretation on it.
Okay.
Interesting. Mm-hmm. So, oral hygiene. Basically, as Ndu says, people know, or just the general wisdom is that brush your teeth, perhaps a mouthwash, and you're okay. But still, people are still queuing to the dentist clinic, to the dental clinics for dental care, losing their teeth. And by the way, a friend of mine once told me that by design, every human being should die of old age with all their dental formula intact. But then the erosion happens. So then one begs to wonder, what is oral hygiene?
That's a nice question, and it gives an opportunity to explore more and maybe bring good context into the table and make the population or the community at large gain and benefit from the same. So when we talk about oral hygiene, all of us, the first thing we do in the morning when we wake up is to start with the hygiene of the mouth, because the mouth is a very crucial and an essence part of our well-being, and it's the entry or the channel through which we communicate with our body. So the mouth is very pivotal. That's why in the morning it's the first place you'll have to check in and make sure that you have maintained your hygiene. So again, you mentioned that despite us following this rather mechanical procedure of cleaning our teeth, we still find people queuing at the dentist for, of course, the dental services. And this now brings, why will this happen? And yet we are following our routine course of treatment, of brushing, and yet we still have to go to and see the dentist. So in a nutshell, I would like to address this by saying that oral hygiene is an individual based, but it's enforced. It's enforced prior by your dentist, and then it comes down to you as an individual now, making the correct follow-up, and then also you have to know the right way to brush your teeth. As previously held on this platform, it was mentioned that when we're brushing our teeth is a mechanical process, and in it we are required to do a circular motion so that we enhance better, and then also we also get to protect our gums. So this is an area that I feel that it needs collective and it needs also to be done at the lower level, whereby the school level, so that when children are growing up, they learn that this is how we maintain our hygiene. So thus, as they're growing, they are less likely to face dental challenges.
Why circular motion? Let's get into it. Why circular motion when you brush? Everybody says all the time.
Yes. We encourage circular motion because, and we only say that's the only way you're supposed to brush your teeth. And we also encourage that when you're brushing, you use that force of a child. The force of a child is that you be gentle on your teeth. Before I dwell into the circular motion, I would like to expand more on the applicability of why we use a toothbrush. So a toothbrush has components. The first component are the bristles. These bristles are shaped in different form, and they can come in different fibers. So these bristles, they are designed by the manufacturer with the intention in mind. It's a quality assured product. So at the end of the day, they are intended to clean your teeth in a sufficient way by applying the toothpaste to your teeth. And then when it comes now about the circular motion, this is intended because when you see our gum line, they are shaped they are embracing the tooth. It's like it's hugging the tooth. So when you're doing the circular motion, you are maintaining the integrity of the gum, and you are not causing further damage to the tooth. Yes.
Okay.
Wow. And yet, as you say, we use the toothbrush and the toothpaste. Those are the basics under normal circumstances when there is no any dental issue. But quality of the toothbrush, because they say change your toothbrush. Is it every month or every 3 months?
Comment 3 months.
Yeah. I don't know whether that is based on the regular of usage, because some people brush once and that's twice or thrice, depending.
A what?
A day.
Oh my God.
A day.
Okay.
Well, yeah. Others. Then the other issue is the toothpaste, because you hear fluoride is not good for your enamel. There's a lot of calcium in some of them. All these products are out here in the market. But for a regular Kenyan who is listening and who really wants to take, because the dental fees are very expensive. Any dental visit will left you dented very well. To an extent of almost losing a tooth. But for a regular Kenyan who wants to take charge of their own oral health, who wants to start a routine that can maintain their dental formula, what are the key basics to consider buying a toothbrush, buying toothpaste, and now the practice of brushing?
Okay, that's a good question. There's one part of your question I didn't answer, and I feel like I can bring it back.
Sure.
So you mentioned that you admire, or your friend mentioned to you, that indeed as we age, we are supposed to age with all our teeth.
Yeah.
This is indeed true, and it's what you are striving to achieve. For instance, Japan, before COVID or during COVID, they came up with a campaign. They call it 2020. What it means by 2020 is that at the end, when you reach 80 years old, you should be able to have at least 20 of your teeth intact in your mouth. And they went ahead just to incentivize by giving a reward. If you find an old person who has maintained their teeth, and even in full capacity, there was a reward for it. So you see that you are incentivizing the public. But now, if you come down now to the common dental problem, as you have mentioned, a regular person, how we can be able to assist them, especially Kenyans, because Kenyans are very informed people, and their context, when you give them good information, they are very good at synthesizing it and making the best for themselves, because they understand this knowledge is for my own benefit. So the best way we can assist the public is by having more dentists out there to the public forum, whereby dentists, the current notion is most of the dentists are based in the urban setup, which is indeed true, because most of them are also trying to make a living, and they also have other social obligations. But for me, majority of dentists I've worked with, they are very compassionate people. And I think most of us, we understand when someone visits us, it can be once in their lifetime. If you look at the current ratio of patient to doctor, there's a big gap that really needs to be addressed. So I've seen most dentists doing their work. They are very passionate, and they take time educating the patient before they proceed to the treatment. I personally will spend much of my time trying to educate the patient. And then also, in addition, I try to encourage the patient when they come for their dental visit, if it's possible, they can come as a family. I also give incentive to them so that they can be encouraged, so that any other time they require dental attention, they know instead of coming one person, we can go all of us. So if they come all of them, we take time, we educate them in the room. This is how you maintain your teeth. This what will help you to enhance your hygiene. And now to your other question about the preferred maybe toothpaste for general cleaning, and then also the myth around fluoride.
Yeah.
There are a lot of myths around fluoride, especially now with social media. And some of these are not scientifically proven, or they don't have evidence that can back it. It's just hearsay. So in my experience and in my learning, I did come to know that fluoride levels are not dangerous to our body. It's only when they exist one part of fluoride, that's when we consider them. Now they can be harmful. And again, they're harmful when only they can be ingested systemically. So this is mean when it starts from the embryonic life. So when a mother is pregnant, it's best and in the best interest that they are protected against the water they are taking. Currently, we do have people who are very active in making campaigns against the effects of fluoride. Most of our regions are in balance. Some regions have good fluoride levels in the water. Some region does have excess fluoride levels in the water. And how we are managing this, we are introducing something we call a reverse osmosis. This is a filter that you attach to your daily water consumption at the house. That's both for cooking, drinking, and it helps to filter out the excess fluoride, so that when your child will be growing up, they are less likely now to face psychological embarrassment or be not comfortable with how they are appearing. Remember, the mouth is one of the very basic thing everyone is proud of. It's the mouth that everyone, whenever there's something in the mouth, you feel uncomfortable to come out in the public. And it's the mouth that also defines you. Your physiognomy comes about because of your smile and everything. And then the most common thing that I found again is that our smile is our identity. At the end of the day, your smile is what can bring much about your kindness with your eyes. Those are the things that will make you show, and maybe in public, people will convince people more. So if this one is taken away from us, we tend to... Yes.
Right. Now, looking at it from another perspective, a lot of us Kenyans will not make a dentist visit unless we have to. Unless there is no other way, unless you can't
sleep at night.
I can sleep at night, unless there is no root I can chew, and it capsizes the pain.
Yes.
But sometimes maybe we don't have to wait until it's that late.
Yeah.
Because someone will notice a bleeding gum and they'll be like, maybe it's my toothbrush. They change the toothbrush. But what are some underlying conditions, in the dental formula, including the gum and all that exist, that perhaps you come across mostly in your practice?
Okay. That's a good question. And it's a common experience in most of the patients we see. They come in and most of the challenges that they report to you, Daktari, I'm unable to chew, I feel my teeth are moving, my oral smell has changed. And sometimes also they can come about, they say if they take anything cold, they feel a lot of sensitivity. They can't entertain something cold. Some will say, I have to mix my water between cold and warm. And then others will come and talk about... especially with the geriatric patient, most of them, sometimes they have undergone to clinic because a patient is a vulnerable person. And inherently, a doctor is someone who is trained and is under oath. So we normally take an oath to protect you. So if you go to a person who is not qualified, at the end of the day, this person is not binded by any oath. And they are less likely to give care to you that is to your advantage. They will consider themselves more. So what we are trying to achieve at this day is by increasing our public advocacy so that people are able to differentiate who is a real qualified person from a person who is trying to cut shortcuts.
Okay.
Yes.
So, if this is the case, why do a lot of dentists then insist that when you have an issue with one tooth that they want to remove it?
Yes, a tooth has a lot of integrity. They exist together in, it's like a team. So if one of your tooth is out, other teeth lack support if there's no rehabilitation. And if they lack support, they tend to drift because it's the contact that makes the teeth to to remain within the bone structure and the gum, and the support of the gum. So if you remove one tooth over time, there is something we call bone reception. That is, the bone gets to reduce by its height. At the same time, your tooth in the socket, the opposing tooth will move because it's looking for that contact. And at the same time, the opposing tooth on the side, which is on the, I will use the term, at the distal end also, will tend to drift to the mesial side because of the forces, occlusal forces that are acting on the tooth.
Okay, so then why do dentists insist on removing the tooth? Because I'll give you an example. I have impacted teeth. So my teeth grow into the bone. So one was removed and I went through hell and I was not ready to do the other one at that time. But now I find that the other tooth is growing because where they would meet, obviously the one down has been removed. So the one upper is growing.
And pressing on your gum probably.
Yeah.
Oh, okay.
So why remove it?
No. Okay.
If we're saying that we should die with all our teeth intact.
Oh, okay. So the specific tooth you're talking about here is called the wisdom tooth. And the wisdom tooth, because if you look at our adaptation, we are still evolving. If you look, some literature will suggest that as we evolve over time, our third molar might cease to being. Because even if you look at it at this point, its size keeps on decreasing over time. So this tooth grows under a lot of pressure. The bone at which it's growing, it's a very limited space. So the tooth tends to maneuver itself so that it can come out and exfoliate out of the gum. So when it does that, its roots tend to bend. And at the same time, remember, this tooth has grown under extreme conditions. So when you're trying to, when it's growing, it's become also an area whereby it's difficult for your brush to reach there. So it's easy for that tooth to form a cavity or a carie. And in other countries that have progressed, it's normally advisable that at the age of 16, when the wisdom tooth is there, you go for a surgical disimpaction. This is whereby this tooth is removed so that you are better off cleaning. And then also this tooth, because it grew under a lot of pressure, if you have any impact at the corner of your jaw, is the area whereby the jaw can fracture easily. So as a precautionary treatment, we normally advise the patient to remove them.
So that's why it's removed.
Yes.
All right. Can we go back to hygiene for a minute?
Yes.
Like when we talk about, oral hygiene, we tend to think, okay, you brush your teeth and then you're fine. But then from what we understand, that there's more than just brushing your teeth to maintain proper oral hygiene.
That's correct.
What's that?
When we talk about maintenance, this means it's an habit. You're going to do it over a long period of time. You're not going to do it today and stop. And we have dentrifices. These are appliances that help you to clean your teeth. Other than the toothbrush, there are other dentrifices that we use to clean our teeth. These ones, they include such dentrifices as dental floss. There are other interdental brushes, and there are also other specific brushes that we use to clean our teeth when we have undergone other treatments like orthodontic treatment and so forth. So when we advise you to maintain oral hygiene, we also encourage you to be visiting the dentist biannually. So by biannually, we are able to see your mouth, we are able to see any disease that is going to progress, and we are able to advise you. So in my health model, for example, I believe in what we call a salutogenic model. In salutogenic model, we base our practices to evidence. We follow the evidence, and then from the evidence, we try to prevent disease from occurring. So at the end of the day, if we have more dentists who are at the community level, they will help to educate the public about how to maintain their oral hygiene. And if the public also adhere to routine checkup, at the same time, they are less likely now to develop oral health diseases and condition. But there's a question he had mentioned that I would like to go back. He mentioned that there are a lot of Kenyans who are suffering from different conditions that are presenting in the mouth. And I wanted to talk about that maybe at length a bit. In the current state of oral health policy and advocacy, we are being sidelined on the talk about NCDs. NCDs, these are non-communicable diseases. The non-communicable diseases, they include diseases such or conditions such as cardiovascular conditions, cancer, and then we also have chronic respiratory diseases and at the same time diabetes. all these diseases are caused by modifiable factors. To mean, the factors that cause the risk factors for this disease are shared. So if you're having a dental problem, it is shared for the same person who is going to develop a stroke or a cardiovascular disease. And the current WHO guidelines is encouraging, it's like a world order for the governments to pay more attention in managing NCDs, because when you talk about NCDs, we are talking about a disease that affects half of the world population. And a disease that affects half of the world population is a disease that is worth paying attention to. So gum diseases and oral health conditions are also part of the NCDs. And in fact, they are a major component of what we call NCDs. So when you find that we are being sidelined in addressing the NCDs, we are leaving a big gap in future, which needs us to focus back, and we address it at the present moment. So I wanted to give an example. For instance, if you find a patient with hypertension, they are normally on the drug we call nifedipine. This drug has a repercussion or has side effects to your gum. Whereby if a patient is taking this drug, they tend to have gingival enlargement. That is, the gum swells and becomes big. Most of these patients, because already they are ashamed of their condition, they don't seek dental attention, and even they don't know it's this medicine that is causing this problem. So we are trying to bring that awareness so that NCD can also include the dentist and oral health provider in their compliance and in their alliances, so that we can tackle this problem as one. So at the same time, there are other conditions such as diabetes. A patient can be just seated, and then without even pus or anything around their mouth, they start noticing that their teeth is moving. So at this level, patient comes to you, they are worried, or they cannot eat. They have not eaten for days, because whenever they put anything in their mouth, they feel the teeth are loose and they are moving. So, and then the teeth tends to bleed easily at that stage as well. So they tend, if they put something in the mouth, there's a lot of blood. And you see, these are things that this patient doesn't know, because they're only seen by a general physician. And the extension to a dentist becomes a problem, because also that knowledge doesn't exist. So if the NCD campaign incorporates dental in it, it will have a wider impact, and it will address most of these issues, because they are all interrelated. Yes.
Someone is asking.
Yes.
Are electric toothbrushes effective?
That's a good question. Again, it takes us back when you brush our teeth is a mechanical process. Most of the toothbrushes from some brands, they are dentists. They involve dentists when they are making them. So even the force at which the bristles are rotating are the force that we recommend. So yes, electric brushes, the right ones, they do have good impact. But if you buy the ones that they are not measured by the dentist, the harm can also introduce harm.
Okay.
Yeah.
All right. Sorry. So
looking at the young ones,
yes,
I think they bear the brunt of the what you'd call neglect.
Yeah.
Because I think as parents, we are very good at making our kids happy. So we'll buy candy, crepes, sweets, name them, the whole confectionery. And only a few months or a few years later, you go to a dentist, and the dentist asks you, you've been feeding your kids sweet. And these are maybe below 7 years old. They may not be as keen on the brushing as an adult would. They need a lot of guidance when it comes to that. But what is the correlation, the relationship between this sweet or sugary stuff and the extent of dental corrosion when it comes to dental issues?
Okay. So that's a good question. And it brings us back to what our teeth are made of. Our teeth are very defined structures, and it's made of different layers. And as a consequence, the food we eat also, some are acidic based, some are alkaline based. And since the tooth is made of a specific structure, when it comes into contact with these acid food substances, they tend to leach away. It's a very micro process, but it has impact if it's done over time. So they tend to leach away. That we call it we call it corrosion. They can corrode away the tooth, leaching some of its material. And when that happens, they develop sensitivity. But let's now go down about children, who are, most of the dentists, despite how children will be, we enjoy working with them because they are very honest people. And when they give you the honest feedback right and there, so you know how your work is going. So most of the time, and again, also there's something that I wanted to address when we talk about children again. So, most of us adults, during our time when we were undergoing dental treatment, or as we undergoing dental treatment, the approach was not that refined as it is now. Right now, before you sit on the chair, we try to calm you through other things. And then also, before we give you an injection, we numb, we do all the things to make you very comfortable and take the pain away. So, but unlike us or our generation ahead, they experience a different experience.
Yes.
And they tend to use that on children by telling them, when children they do something wrong, they'll tell them, "Takuchukua kwa daktari." I tend to think that we can try to avoid it because at the end of the day, the children tend to fear us because they think we are somehow, but we are not. We are trying only to enhance their care, and things have improved. So as much as we the older generation went probably this experience, I feel it's wrong to share them on children. We should let them have the experience at the dentist so they're determined. So now going to the sweets and maybe the sugary things children love. To some extent, sometimes we allow them. We don't take them away from the children, but we advise the parent to make sure if the child has taken something which is sweet, they give them water to rinse off their mouth. And that one also, again, I want to address something back now to when a mother is nursing, because it's the same thing that we will use. The breast milk has a lot of sugar. And most of the time you find the baby will cry at night. So the mother will nurse them at night so that they can go back to sleep. But then when they do that, they tend to forget, or they don't have the knowledge to know that this milk has a lot of sugar and you're supposed to protect the teeth of this baby. So our advice is normally when you nurse the baby at night, you can find a clean cloth, you just put some water in it and you clean the teeth.
They're going to sleep.
Yeah.
These are
Yes, I know it's tedious. I know it's tedious.
Not even the tedious. They will wake up.
They will wake up.
Them
You are
to
trying them to
Yes,
sleep.
but then maybe you can make the clothes to be warm. On maybe you can give them a bottle of water to suckle on so that it clears off Our intention is to clear off the milk from the tooth.
Okay.
Yes.
I want to go back to the fluorosis issue because I see a couple of questions coming in on that, but it's a thing that a lot of the water that's being consumed while mothers are pregnant and then while babies grow up in an environment where they are, ingesting this water, because whether you use it for cooking, whether you use it for brushing your teeth, it's going to have an effect. So we have high salt levels and fluoride levels in water in many areas of the country. What we hear is that there are techniques that, and so of course then we get the stained teeth with the levels of fluorosis that we see affecting teeth, whereby you can go from slightly brown to almost black, like we've seen in many cases, almost completely black. There are things that we've heard can be used, bleaching, coloration, and that once fluorosis has set in, there's really nothing you can do to go back. But you can change the appearance of the teeth. What are some of those methods that you can use? First of all, to stop further fluorosis, and then also because it's a social issue as well, especially when it's among children. Children can be mean. Children can be quite mean when it comes to the self-esteem and all of this. So what can you do to enhance the look, first of all, and then what can you do to stop? You talked about reverse osmosis and things like this. What can we do?
This one calls for a national approach. This one cannot be solved in a private way, because for me, I feel it's something of public interest. The level of fluorides in our regions vary, especially in the Rift Valley. They tend to be high, and other regions also they can have high fluoride levels.
This region,
Eastern, yes. Going up here, the level of fluorides are high. And if we have a public approach whereby it's embedded within policy, we will have in this area public health officers enforcing there's no water that should leave its source to and it's being piped to households or where people are drinking without that reverse osmosis filter. But then, as we wait for maybe this to be achieved, we normally advise parents, especially those who are at the childbearing age and of course they are intending to grow a family, they should at least ensure that they have one filter in their house so that it filters out the fluorosis, and then we can prevent fluorosis from. But for the cases that have already occurred, what we are looking at, it depends on the severity. In literature, we normally grade fluorosis into 4 grades, from mild, moderate, severe, and there's another grade that is there. So for the mild and moderate, these are processes probably we can try. There are 2 ways. The mild one, maybe you can do bleaching. It can give you results. For the moderate one, we normally advise the patient to consider veneers. Veneers are aesthetic chromium zirconium crowns that we put on the teeth, and it's most likely what people who are financially enabled go for, because it really enhances your look, and they are very aesthetic. But for the severe cases, sometimes we don't want to interfere, because then when fluorosis occurs to your tooth, it makes the tooth to be brittle, because the tooth has taken in an additional structure. It's a chemical process that occurs, binding and making the tooth to be more hard. But when it exceeds the region again, it makes it to be more, it's like glass. So there are some levels that we don't want to interfere again if there is no symptoms. But if there are symptoms, we normally try to treat the symptoms so that, yes, the tooth can do other functions without pain.
So what about masking? I've heard about masking.
Yes.
What does that do?
Masking is a temporary procedure. I will not call it permanent.
So it's bleaching. Bleaching is temporary as well, isn't it?
No, bleaching is permanent.
Okay.
Yeah. But masking, we normally, when we are doing masking, we inform the patient that this one can have stain again in 10 or 5 years. So if you are comfortable, we are going to do it, so that after this time, if it's stained again, you can come, we redo it. But yes, masking is good. It's what is most people can afford. And when it's done right with the right material, it's impeccable. It's something you'll admire. But then the other thing that I wanted to address maybe out there to people, because also I'm a dentist who is keen on sustainability practices. We are trying to encourage dentists to use materials that are sustainable, so that we don't cause a lot of harm to the environment and then leave a big trail of our carbon footprint. So in the present days, yes, we do encourage masking, because we understand what self-esteem means to you, and we understand also your physiognomy also is dependent on your smile.
Are there downsides to masking?
The downside to masking is one, yes. If it's not done correctly, the patient might experience sensitivity. But when it's done correctly with a qualified person, it's excellent.
Okay.
Someone is asking, one of our viewers, in your line of current practice, is SHA covering the preventive or other dental care services?
Yes and no. Because SHA is categorized. They are civil servants, and then there are those who pay off their pocket. For the civil servants, most of them, they get to enjoy a number of procedures. For the common person who is not employed by the government, it becomes a challenge. They are required to, again, go to their pocket. And we see that as, again, bringing about health disparity and creating, again, a gap in health. Because we understand the current policy in health is to enhance universal health coverage. When we talk about universal health coverage, we are trying to make health accessible, affordable, and equitable. So if other services that are crucial and are needed by this patient, there are for services that we consider them emergencies in dentistry. That's what a lot of people don't know. And there are services that you require them, you cannot do without them. And yet we found some insurance sometimes, they tend to reject them. For instance, let's talk about that patient with hypertension. If this patient with hypertension comes to the clinic, it's an urgent need for us to help them maintain good oral hygiene. But then sometimes those procedures we do, the insurance tend to shy away from them, which I feel they need to be informed more, because this is a life-saving procedure to this patient.
Yes, right. And now, you mentioned very interesting that sometimes maybe in future we may have is it a generation due to evolution who will have fewer teeth? They might lose their third molar.
Yes. Not losing essentially, but it's the size is reducing.
Right?
Yes, yeah.
And looking back, have we lost a reduction of some sort?
I wouldn't like to bring that, especially at this stage, but it's a literature I've gone through. So maybe I revisit it and I see. But yes, there was that. There's that
theory.
Yes.
Because evolution also is very controversial. Yeah. But now there's the issue of dentures, because we spoke about not losing our teeth.
Yes.
Then, but when we do, sometimes it's inevitable. Could be as a result of an accident, or then poor oral hygiene. Also, genetic factors. I think there's
correlation.
Yes. Yeah. What's the place of dentures in current practice?
So I've had the privilege to work both in public and in private, and there's a big need for correct processes to be given out there. When we talk about denture, it's a subspecialty in dentistry, which is under a specialist we call prosthodontic. Now, prosthodontic, they help us to rehabilitate or bring about anything which is unnatural to the body. So most patients, because of also insufficient or adequate dental personnel out there, they have ended up losing teeth. And some of them actually, it impacts directly on how the food intake they are taking, because someone will avoid a certain meal, and this meal yet is the nutrients they need most in their body. So it's affecting their general well-being, and their quality of life is shredded away. So these patients, we normally encourage them to, most of the public hospitals, they are doing these dentures, and most of them are doing them very well. There are places where they have prosthodontists who are doing very wonderful job with the community, and they are relatively cheap. What I would like to say to the public that if you are rehabilitating your teeth, we normally encourage you, and at the end of the day, we incentivize you by reducing the cost for that. So there are two types of dentures, for instance. We have the partial dentures, those that covers. If you have lost part of your teeth, we partially cover you. And then we have complete denture. If you're dentulars, you have lost all your teeth, we normally give you a complete denture. Now, this denture, depending on your financial strength, can come either in terms of a resin denture or a cobalt chromium denture. All of them, they have good function, and it's actually highly encouraged. If you have lost your tooth, it's highly encouraged that you rehabilitate the mouth, because if you don't rehabilitate the mouth, the side that you have lost the tooth, you remember our face, our chin is made up of muscular structure. These muscles help to bring the jaw up and down, sideways, and all the side. So if at a particular side that we have lost the tooth, the muscle tends to grow more towards that side. When it grows more towards that side, it pulls your cheek also inside. So that's why you find most of these patients, the muscle tends to collapse inside. It's not collapsing because it lacks that support. Your teeth is like a wall.
Now, there's a new trend. Sometimes for optics, sometimes for health reasons. The braces.
Braces.
Especially for those who do it for optics. What's your take on that? And what's the qualification for one to be told, yes, indeed, clinically, you need to have braces?
Good. So braces, first of all, they fall under a dental specialist we call orthodontic treatment. Orthodontic treatment, they help us to align our teeth in the desired occlusal form and in the desired aesthetic form. So when we grow up, because also lack of that capacity to see a dentist. Sometimes the parent tends to advise the doctor or that particular physician saying the child to do the extraction. When you do early premature extraction, we misguide the tooth which is growing underneath, and it misses its path because the tooth which exists there is the one that guides it. It is required, if it was necessary indeed for you to remove the tooth, they should put a space maintainer to maintain that space for the tooth, the incoming tooth. If you don't, that your tooth become crooked.
Yeah.
Now, when do we say that you qualify for the odontic treatment? If you have been under observation by a dentist at the age of 11, 12, 13 upwards is when we can consider, because at that time you have finished the milk tooth and the primary tooth now are all inset in your mouth, and then also your jaw development at that stage is very crucial and it can help guide the teeth in the better place. Yeah. So, but also you might grow up at minus that age and you find that you did not get these services. It's still advisable you come. So you can just come at any time, but the dentist, we do diagnostic procedures, and their orthodontic has also improved. There are other methods that we are using currently, the Invisalign, for which the patient is able to be guided from the first day when you are designing to the last day. The patient is also able to observe the treatment and also is able to consent now to your treatment.
Okay.
Yeah.
So a couple of questions
Yes.
around milk teeth, because we know they fall out,
Yeah, yeah.
then you don't get them back.
Yeah.
Obviously, you get your permanent teeth after that. But then, at what age should teeth actually start protruding from the gums? And as you know, you see when a baby has started teething, there's some discomfort, you know, and you can tell usually what's about to happen. And then you link it later and say, oh, okay, they're teething. At what age should the teeth start protruding? And then, as teeth start falling out, as the milk teeth start falling out, sometimes they shake, they get irritated. Should you help them along and remove them, or should you let them fall out naturally?
Okay. Thank you for the question. Teeth have their biological clock. We expect at 6, we expect some teeth in the mouth. And then
6 what?
6 months.
Okay.
Yes.
All right. I was going to say that's a while.
And then we go to 36. So that's the last tooth. We expect that's the last tooth to come in. Now, there is a lot of misinformation around that age. Because that age, the child is in a stage, we call it the orophallic stage. The child is likely to pick things to their mouth.
Yes.
And with the environment, there are microbes and bacteria. So the child is feeding the microbes into the mouth. So, and you find that time is when the gum is tender. So there's likely exposure and contact can come in. That's when there's swelling, the child starts rearing and fever. But sometimes this is misconstrued, especially in our community. We have a phenomena, we call it infant oral mutilation. Infant oral mutilation is whereby a child becomes sick at that age, the mother is worried, they take them to traditional healers, and these traditional healers, they tend to think it's the gum that is causing this problem, not the contamination that came about. And they end up scrubbing it with traditional, it's called mutilation for the word. It's basically mutilation. And in most cases, some of the patients, they have ended up dead. And some of the patients have ended up bleeding into the emergency.
Wow.
Because then these people are not in a capacity to control that, and then also they leave infection around. So this is also another campaign that by the dentists, we are trying to create awareness around the practices, although it has gone down, and it's an old practice that is introduced in the country. It follows a belt all the way to West Africa, but most of it has gone down. So, yes.
Now, is it true that a toothache could even lead to a brain infection, or gum infection could lead to the brain infection?
Yes. And sadly, we have seen such cases, and they are not good cases to see.
Right.
Our head and neck is our specialist as dentist. And there are a lot of structures that are connected to your body that passes through the neck. In the neck, there is one particular muscle that will go all the way to your body, covering all the muscles. So you're like, I don't want to use the term, but you're like a sack. So if there's any infection that will get from your teeth and enter that space, it can travel literally anywhere. And it's the worst case you can see a human being suffering, because it deforms the person, it strips them of dignity, and then also it brings about, you cannot stay with people because the smell that will be coming out of you, no one will even go near you. And these are the cases that are somehow on the rise in the current moment, because even in my during my internship period, what I got to experience really is something that I feel like it needs a lot of addressing. Because patients goes to clinic with quack people, they do extractions, that extraction develop infection, they are not attended right, and currently we have what we call antimicrobial resistance amongst our population. This antimicrobial resistance means even if we give the best antibiotic, we are not able to fight this disease. And it's going to be common if we are not putting everything in check and having the right people attending to our people. Yes.
Wow.
Yeah.
You mentioned earlier on that you do, can I call it oral? Activism.
Yes.
For
Advocacy.
oral hygiene,
Yes.
advocacy for oral hygiene. So what are some of the activities you are into, and then where are you to be found? Because people need to know, at least because somebody said you should visit a dentist at least twice a year, even if it's for just a salamutu, consultation. Yeah.
So as I speak here as a dental champion or an advocacy champion, my intention is to enlighten the public. And again, it brings back, I say, I love the salutogenic health model, whereby we go and address the problem at the community level as opposed coming to treating pathologies. So how